So here is a case scenario. A 32-year-old male with a 2-day history of fever, vomiting, diarrhea, and he complains of myalgia, especially in the calf muscles. And he also gives history of working in flooded fields after heavy rain. And on examination, you notice there is mild icterus, conjunctival suffusion, and his urine output is normal. And from the history, we can say that there is an infection because there is fever, vomiting, and diarrhea. And this history is very important. That he says he has been working in flooded fields after heavy rains. This is important. Why? Because some zoonotic infections can be spread through contaminated water. So we have to keep it in mind. And you notice mild icterus and conjunctival suffusion on examination. When there is mild icterus, we can say that something related to liver injury. So here liver injury has occurred. So we should narrow down our diagnosis to certain conditions which can cause infection along with liver injury, and you order some lab investigations. And here are the lab findings. Serum urea is elevated 120 milligram per deciliter, and his serum creatinine is also elevated, and serum potassium levels is decreased. Normal serum potassium level is 3.5 to 4.5 millimole per liter, and here it is only 3.1 millimole per liter, and his platelets count is also reduced. So from this scenario, we can say that there is acute kidney injury has occurred. Since urea and creatinine levels are elevated, there is acute kidney injury. Why there is acute kidney injury means because of vomiting and diarrhea. And because of vomiting and diarrhea, the renal perfusion will be reduced, and it causes reduction of GFR, and that produces AKI. But his urine output is normal, so it can be termed as non-oliguric AKI, non-oliguric acute kidney injury. Since there is no oliguria, his urine output is normal, and this serum potassium level reduced. That hypokalemia is very important. I'll let you know in few minutes. And this is the eye of the patient, where you can see there is conjunctival suffusion and there is some mild icterus present. So the diagnosis is leptospirosis, or it is also called as Weil's disease. And this history of working in flooded fields is very important because leptospirosis spreads through contaminated water with animal urine, like rodents urine, like that. And the main complaints will be fever, vomiting, diarrhea, and conjunctival suffusion, as we seen in the case scenario itself. And this conjunctival suffusion will be without inflammatory exudate. And leptospirosis in severe cases can cause acute kidney injury and liver injury. In this case, there is both liver injury and acute kidney injury are present. And treatment of leptospirosis is, in mild cases, we can consider giving doxycycline, and in severe cases, we should give IV penicillin G and ceftriaxone. And hydration is very important, since there is reduced GFR due to reduced renal perfusion, as there is increased volume loss in vomiting and diarrhea. And this serum potassium is very much important in ruling out other conditions of acute kidney injury, because in other causes like sepsis, shock and all, there will be hyperkalemia. In other causes of AKI like sepsis or shock, there will be hyperkalemia, increased potassium levels. But in AKI, due to leptospirosis, there is hypokalemia, because in leptospirosis there is predominantly involvement of proximal tubules more than distal tubules. and proximal tubules will be affected more than the distal tubules, since the distal tubules are comparatively normal functionally. There is no potassium, there is normal sodium reabsorption takes place, and as a compensation potassium is excreted out from the renal tubule. So there is potassium loss here that causes hypokalemia. But in other causes like sepsis and shock and all, both proximal and distal tubules will be affected. And distal tubules will be predominantly involved in other causes of AKI like sepsis and shock. So there is no potassium secretion. Since if the distal tubules are normal, there will be normal sodium reabsorption, and for that compensation potassium loss occurs. So that happens in leptospirosis. But in case of sepsis and shock and other causes of AKI, since the distal tubules are also affected, there is no sodium reabsorption. And since there is no sodium reabsorption, potassium cannot be lost through the tubules, and this causes increase in potassium levels, and this causes hyperkalemia. So this is a very peculiar point to diagnose leptospirosis. The take-home point from this concept is AKI due to leptospirosis causes hypokalemia, but other AKI in conditions that causes AKI other than leptospirosis, there will be hyperkalemia. So this is the take home point from this concept. Thank you.